The purpose of this video is to offer information on cognitive communication impairment. It may be that a friend or relative has recently received this diagnosis, or that you work with people who have this diagnosis, and you want to know what it means for that person and how you can help. How does cognitive communication impairment impact individuals? Communication difficulties that result from cognitive communication impairment can significantly impact how easily a person copes with everyday life, how much they take part in social environments, and their social relationships. As well as this, a cognitive communication impairment can also lead to a person losing their social roles and cause changes to a person's personality. The Brain Injury Association, called Headway, suggests it is important to understand more about cognitive communication impairments and have an awareness of useful communication strategies to aid conversation with a person who has cognitive communication impairment. What is cognitive communication impairment? It's important to remember that communication is a complex skill which requires lots of core brain skills such as attention, memory, problem solving, information processing, and organisation. And these skills are called cognitive skills. A cognitive communication impairment occurs when a person's cognitive skills are affected as a result of brain injury. So what are the presentations typically seen in cognitive communication impairment? Reduced attention and concentration. This may mean that a person with a cognitive communication impairment has difficulty paying attention to a conversation and therefore misses important information which could lead them to say inappropriate replies or end the conversation abruptly. As well as this, individuals may also jump from topic to topic during conversation or have difficulty maintaining a conversation. Memory problems. This means a person may fail to remember names, faces, or information relevant to a conversation, which again could lead to breakdown. Memory problems could also lead to someone repeating the same topic of conversation or asking the same questions over and over again. Literal interpretation. This means a person is not able to grasp humour or sarcasm in a conversation or able to understand common expressions. For example, "That's the last straw." A person may interpret this expression as meaning that there are no straws left, rather than the person is running out of patience. Reduced reasoning and problem solving. This will affect a person's ability to understand someone else's point of view and may be inflexible in their own opinions, which can lead to the person appearing very stubborn. Cognitive fatigue. A person with cognitive communication impairment is unable to manage their cognitive skills as well as they once could. Therefore, their attention and concentration will be greatly reduced, as well as their ability to think clearly, which can lead to agitation. Fatigue can also worsen other communication difficulties the person may have, making their speech and/or language less intelligible. Slower information processing. A person will not be able to keep up with a fast-paced conversation, such as talking with more than one person in a conversation or conversing in a busy setting. This can make the person feel overwhelmed with information and could result in the person becoming frustrated and switching off from the conversation. Impaired social skills. A person with cognitive communication impairment may not recognise social cues or adhere to normal social behaviours effectively, for example, saying the wrong thing at the wrong time or in the wrong place. Other difficulties which will impact communication includes altered turn-taking skills. This means the person with cognitive communication impairment may not realise when it's their time to speak, or they may be overly talkative and not let other conversation partners speak. Interrupting someone else in fear they might forget what they want to say. Speaking only about themselves and being fixated on certain topics important to them. Talking explicitly or swearing at inappropriate times. Being unable to read non-verbal cues in conversation, such as communication partners' facial expressions or body language. Reduced insight can sometimes occur in cognitive communication impairment, and this means that the person may believe they are acting just as they did before their brain injury, and are not aware of the cognitive difficulties which they have. This can be difficult for changing their social behaviours if the person doesn't believe there is anything that needs changing. All of these common presentations mentioned can lead to communication being less successful for the individual with cognitive communication impairment. So what is the role of a speech and language therapist in cognitive communication impairment? Managing cognitive communication disorders arising from a brain injury is integral to a speech and language therapist's role, as speech and language therapists are uniquely trained to manage communication disorders and have essential clinical knowledge regarding the interaction between cognition and communication. Speech and language therapists will start by assessing a person with cognitive communication impairment to determine which cognitive skills have been affected by the brain injury and what impact these are having on the person's communication. They may also carry out questionnaires to assess the person's insight into their difficulties. As well as this, speech and language therapists will often speak to a person's communication partners about the person's communication style before the onset of their cognitive communication impairment, as this will give them a greater understanding of the impact the cognitive communication impairment has had on that person. After this, a speech therapist will develop client-centered goals for therapy and carry out intervention which will help to improve a client's interaction in their typical everyday communication environments. As well as this, the therapist will teach the person compensatory strategies for cognitive skills which do not increase with therapy. The ultimate goal for cognitive communication intervention is to help the individual achieve the highest level of participation in everyday communication life. As well as working one-to-one with the client to help improve their social interaction skills, speech and language therapists also offer communication partner training to those who are likely to interact with the client in different contexts, for example, friends, relatives, carers, hospital staff, work employees, etc. Speech and language therapists help to train these communication partners to ensure that they are able to socially engage with the person who has a cognitive communication impairment and help them to socially participate in various contexts. So what can you do to help a person with cognitive communication impairment to communicate? Some useful tips include ensuring you have the person's attention before talking to them. This can be done by saying their name and making sure that they look at you before giving information. Aiming for a quiet setting with reduced distraction, as this will help keep their attention on the conversation. Breaking down information into small chunks. Use sentences with pauses in between to allow a person with cognitive communication impairment more time to process the information, rather than trying to process long sentences all at once. Asking one question at a time. This again prevents the person becoming overloaded with information and not being able to process it. Do not suddenly change the subject. If you want to change the subject, make sure you make it explicit that the topic of conversation is shifting. Facilitate decision-making by offering choices. This again reduces the amount of information the person has to process at one time. Avoid sarcasm and use of non-literal expressions. If a person has literal interpretation, then they will not be able to interpret these, and expressions may cause confusion and a breakdown of the interaction. So long as it's not too overwhelming for the person, encourage them to make eye contact when talking, as this will help with their concentration. Respectfully and politely tell the person when their behaviour is inappropriate and explain why. Support the person to use a reminder system if they have memory difficulties. This can be in the form of a diary, post-it notes, or even mobile phone reminder. Look out for signs of fatigue and allow the person to end the conversation if they get tired. Do not expect them to continue a conversation if they appear tired, as this will likely increase their communication difficulties, which could cause the person to become frustrated. Explicitly explain your point of view when talking about a topic where you may have differing opinions. And finally, give lots of opportunities for positive social communication. The more the person interacts in different contexts, the more likely it is for therapy strategies to be applied to newer contexts. Cognitive communication impairment can have a negative effect on the person with the diagnosis, but similarly on friends, families and carers too. The person with cognitive communication impairment may appear stubborn, bad-tempered, aggressive, and just not themselves, and this can be very stressful for friends, families and carers. But there are lots of different places which can offer further education, support and resources which can be extremely useful. These include Local support groups for those looking after people with a cognitive communication impairment. Communication partner training sessions with a speech and language therapist. Discussions with speech and language therapists. Online training for healthcare professionals. And impairment websites. Impairment websites can offer lots of helpful information about cognitive communication impairment, as well as giving useful resources and contact information for support groups and charity events. Some useful websites include Headway, Stroke Association, the Royal College of Speech and Language Therapy, Communication Matters, and Find a Voice. Thank you for watching this video. We hope it was useful and informative.